How can I tell if I need orthodontic treatment?
Beauty lies in the eyes of the perceiver, or it's something subjective. As I said, I do have patients when I told like you need a dire need of treatment, and they just nod their heads, no, look, I don't want. And some people, do you need treatment, it's just minimal here and there, but they want it. So it all is aesthetically driven. Majorly, yes. So if it depends on your personal appearance, personal view, how you perceive yourself as you go. If earlier days we are our needs are funded by our parents, and maybe they cannot afford, and as we grow up we earn, and now we are more conscious, beauty conscious. We want this incisor to be aligned. I think my canine is just drooping down, I want to align that. My lower teeth are crowded. So patients come with different complaints or aesthetic needs. That is one. Aesthetics is one, and second is functionality. Some cases when patients do have crossbite is both upper teeth are usually outside and lower teeth are inside. So the lower teeth is in arch form and it is in the confines of the outer perimeter of the upper arch. So if the one or the other teeth or set of teeth or even jaw is misplaced, then it goes into a crossbite. So that is not good for the health of the tooth, nor it is good for the growth of the jaw if it's a growing kid or adolescent, and if it's full grown adult as well. These cases where it's crossbite or jaw is growing waywardly, so then that may lead to temporomandibular dysfunction, which many patients do complain these days of clicking, popping in the jaw. Not able to chew properly. When I'm chewing, it's hurting. It's all because of lack of proper interrelation between the upper and lower teeth and jaws as well. So that is one, functionality and occlusion. So aesthetic, so in orthodontics we balance everything. So we go for aesthetics because there is a science for aesthetics too. So when a dentist does a treatment, it is science driven and also beauty driven. So it's a marriage between a aesthetics and the science. So what orthodontist does is, according to the science, we have to get the teeth into a particular position. And how do we do it? So we formulate steps how to do it, and then we get to our treatment plan. And we tell to the patient, yes, functionally, for when we do initial consultation, this is very functionally necessary. And we evaluate even the aesthetic needs. When we do initial consultation, we also do psychological evaluation of the patient, because many a times what happens is the patient has totally out of the world expectation at the end of the treatment. So we make them realize that what could be the possible outcome of the treatment, so that everybody is in the same page and are content at the end of the treatment. Many people think that, okay, I'll become Brad Pitt after the treatment. Then no, Brad Pitt is Brad Pitt, but in the given confines of your genetics and face, what we can do, how we can move the teeth, and how it would look. So there are some visualization softwares as well. Those are smile designing, but those are not very precise. There are some scope of improvement in that, and I'm pretty sure with AI things will be much advanced in next decade, which will govern or monitor the changes for any field. And orthodontics is nothing apart from other scientific fields.